beautiful night, isn't it? And actually, believe it or not, he's actually performing right there at the Black Box Theater. Saturday, May 13th, 4 to 6 o'clock p.m. Black Box Theater, Indian Head, Maryland. Indian Head, Maryland. We're bringing you the wonderful sounds of Mr. Greg Boyer, along with his ensemble Peloton, and they're going to accompany the Roland GRIMES show live. It's going to be a very, very, very unique event, very unique situation. The kids in the neighborhood are fighting over the mics.
No, we're not.
So,
No, we're
bro,
not.
you can pull that mic.
He wants to share with me. I was
share.
saying he can pull the other. He wants to share with
No,
me.
that's your mic, sir. I'm gonna do a lot more listening.
Okay, the kids gonna stop. We gonna stop.
Yeah.
All right, so I'm at a vegan restaurant. I'm gonna have a Yankee Doodle while they argue over the
And your dentist is here.
and my dentist is there. I know, right? Ladies and gentlemen, for those who don't know, I'd like to present to some, introduce to others for the first time, my good friend. You're going to get a chance to see him live and in person in about 13 seconds. Count it down. 4, 3, okay. All right, my clutch is stuck. Hold on.
98765.
I know, right? Don't you hate that? Isn't that like a song or something?
Yeah,
Blow your whistle.
Night.
Man,
5, 4, 3, 2, 1.
you know it's coming in a minute. See, this is what happens when Ron isn't here.
What is
Save your
wrong?
time for me.
Ron, it's what you call landscaping season.
Okay.
Ah.
Yeah.
Yeah.
The weather has been great, so.
Right. So Ron is now.
An Indian head.
Yeah, Ron is busy.
A lot of
Busy.
$2. Just saying.
All right, there it is. Bam.
There we
My
go.
man, Dr. Vincent Davis. How are you, my brother?
I'm doing well, and you?
I'm doing exceptional. Let me see. I'm going to have you say to me real quick one more time. I'm going to set your levels. Dr. Vincent Davis, where you from, my brother?
I'm originally from Washington, D.C. and Capitol Heights.
Really?
Yeah, I went to Capitol Heights Elementary School.
Is that right?
That's right.
Capitol Heights, how old, man, Capitol Heights, how long has Capitol Heights been around as a community?
Oh, a long time.
Really?
Yeah.
I found out about it when I was like in the 10th grade, because I was in D.C. So you from D.C.?
Yeah, I was born in D.C.
Okay.
Yeah,
But you spend most of your time in the Capitol
yeah
Heights
most
area?
of my time in Capitol Heights, and then I'm a tale of two upbringings. One in Capitol Heights, Maryland, and one in Potomac, Maryland.
Okay.
Yeah.
Tell us about Potomac.
Well, there was, let me see, probably out of 400 students in my high school, we probably had about 30 blacks.
Okay.
Wow.
Yeah.
Okay. And you were one of the 30.
I was one of the 30.
What was that experience like for you at that time?
It was a good experience. I had a great time. The black community, we were very cohesive.
You had to be.
You had to
30
be.
guys.
Yeah, we had to be.
Yeah.
I experienced a little racism, but it wasn't that bad. It wasn't that much. I think a lot of it had to do with my personality, because I'm pretty laid back. I don't take anything too seriously.
Yeah, I would agree. You're
And I'm
not
a large man. So
You're not a highly confrontative big black
yeah,
man.
Yeah.
You know, and I've known that since I've known you, man. That your personality, your disposition is one that makes you very approachable. I appreciate that. And then when I found out what line of work you're in, I said, man, that's great. It's actually not that I've had great experiences with dentists. Don't get me wrong. I'm not going to put out dentist jokes. I'm just sitting here and I'm saying from the standpoint of at least being able to approach someone, have a conversation with them, get to know them a little better. And Everlasting Life has been a wonderful experience for us, man, just to be able to connect. As I pass it on to my colleagues, I just want to ask you, I have an idea as to why you decided to take roots in Capitol Heights and even open your practice here. But give me the short end of that long story, brother.
I'm committed to our people on multiple levels, because we have issues, some that we know and some that we're totally oblivious to, and it's my mission to, as many levels as I am competent in, is to do my part to address those issues in our community. not just healthcare, but other issues also.
How do you go about doing that?
Doing shows like this, just talking to people. I do most of my problem solving privately, one-on-one, or small groups. When it comes to healthcare, dentistry, when it comes to spirituality, when it comes to the many legal issues that plague us in this society, and the lack of our knowledge of history and in this society, I address those one-on-one, and small groups, maybe 10.
So you're not just a dentist, you're a mentor as well.
Yeah, I would say so. Yeah, I share things when people are in the dental chair because they're captive.
Right.
And a lot of times my appointments, sometimes they go on longer than I anticipated because the things that I share, people get interested in.
Making a human connection to
Yeah.
folks. So, Doc, I'm going to have you, soft-spoken as you are, I'm going to have you speak up just a little bit louder
Okay.
so I don't get as much echo.
All right.
And Frank, man.
Yes, sir.
When's the last time you went to the dentist and what was your experience like?
The last time I went to the dentist, I would say about 6 months ago to have some work done on a cavity.
Okay.
But I need to go back for my next cleaning. But I was going to ask the doc here, I've read a couple of times that your dental health is just as important as your heart health. Am
No.
I correct in that?
I would, on a common sense level, I keep it real. Okay, I don't.
Okay.
Just when you
The propaganda is one thing.
Yeah.
Right, okay.
When you come here, it's the no hype zone. I'm giving you the real deal on everything.
Man, you know what? I think that's the name of your show, the No Hype
The
Zone.
no hype zone.
Coach Tanya. All right? He needs a show. Take care of that for him.
The no hype
We'll
zone.
call it the No Hype Zone.
But when we just apply the doctrine of common sense to that question, you have 32 teeth. You only have one heart. You only can make one mistake with the heart, but you can make 32 mistakes with the teeth. And guess what? Even if you make 32, you're still going to live.
Right.
Right.
Okay, but that's not to say that that things that occur in your mouth can affect your heart. Okay, it can. The bacteria in your mouth can seed the heart, and it can cause some problems.
Wow.
Does it happen all the time? No, but it can. Just like when patients have joint replacements. The literature says it has happened that bacteria from the mouth has infected joints. So, and when patients get kidney transplants, they want any source of infection to be cleared up. They want any source of infection to be cleared up. So it does have an impact. But is it the same as the heart? No.
What do you think about implants, Doc?
Oh, the implants are great.
Would you recommend them?
Yes, I would recommend. Absolutely. Absolutely.
And what is the actual, age that you can actually keep them? Is it permanent? Is it a couple of years? Or?
Well, I understand your question, and it speaks to guarantee. Healthcare procedures cannot be guaranteed because the starting material and conditions vary. In your mouth, it can vary from one side of your mouth to the next.
Okay.
Okay, but they, as I tell my patients, they last a very long time if properly diagnosed and properly completed. They last a very long time.
Okay, great.
I have a question. Now, one of my children, he's an adult, but he still has baby teeth.
Okay.
Should we worry about that or get them taken out and replaced?
How old is the
26.
26?
Yes.
Probably, without looking at X-rays, the adult tooth did not develop.
It did not.
Yeah. And so as long as it's not causing any pain, it's maintaining the space, it's maintaining the integrity of the dentition. What I mean by integrity is the straightness of the teeth.
Well, he's had braces before,
Okay.
so, and everything has been aligned and everything since then.
Yeah, I would, if you take it out, then you have to ask, well, what am I going to replace it with? and it's probably an implant.
And they are mighty expensive, I might add.
Expense and price depends on who you're talking to. Okay, it depends because it really boils down to what people value, and what you value is determined by where you spend your money and where you spend your time. And you know, some people spend a lot of money on health. Some people spend a lot of money on cars. And you would put the same amount of money into a car if that's what you valued. Some people would say, I'd never put that much money into a car. What brings you joy? At the end of the day, it's what's going to make you happy. That's where you're going to place your money and your time.
True, that's true.
Now that's a very balanced look at some things that we struggle with, that we have to make considerations about every day, because if you think about it, I mean, I can readily conceptualize putting $50,000 into a car, but I would have trouble saying, man, I'm going to put $2,000, $3,000, $4,000 into my mouth. But in reality, when you stop and think about it from that perspective, and that's great, because in the no hype zone, those are the kinds of things that we need to discuss. However, I found out over time, and if I'm incorrect, just let me know, that it may not be accurate to call you a dentist. There are different levels of orthodontistry. So can you break it down for us a little bit so folks can understand what I'm just learning again, since my mother was in that business at Howard University? What are some of the levels of dentistry that we should be conscious of?
Dentistry is quite a interesting and broad field. Like I've branched. I'll start from the top and work to the bottom.
Awesome.
One of the things that I treat, it's not a board specialty in dentistry, but head, neck, and shoulder pain. Okay, and it has a lot to do with the way your jaw is positioned, your lower jaw is positioned. And there's something that is called the superior functional unit, and the jaw, the cervical spine, and the collarbone, and your first 7 cervical vertebrae work as a functional unit. And when one is out of balance, the other is out of balance, and it can cause significant pain, primarily in women. Primarily, it's seen in women.
Well, I've had it for 23 years.
Yeah,
So is it
nonstop.
Is it pain like in your lower back, upper back, or your
Oh,
mouth?
your back, your neck, your head, the
all
top of
the
your
above.
head, your jaw.
Wow.
Yeah, I have a 24-hour headache that never goes away, and it began as a result of it was a combination of football stress and then some trauma.
Yeah.
And the stuff got out of line. And okay, you got a cervical disc out of joint. Okay, and then wait a minute. Your jaw clicks, so you have a TMJ problem. So now the spasms in your head.
Yeah.
So I'm going to him to get some of that looked at, so you can break my neck a couple times and feel better.
we don't want to make.
I mean, you know
worse.
what I mean. I'm joking with you.
Let me. It's we're in the no hype zone. I keep things very simple. Most of the headaches that people get are simply muscle spasm headaches that are associated with the muscles that allow you to close your mouth. It's no different than getting a Charlie horse in your calf muscle or
Hamstring.
in your hamstring or your groin muscle. Okay, it comes from overuse, and because like some patients, their superior cervical unit is so out of alignment that they have balance issues. And if they bend over to pick up something, they're clenching their teeth just to pick up something. Okay, and so that can create an overuse. The muscle fatigues. It goes into a spasm. Okay, and when you understand what to do, you can break the spasm just by putting something between your teeth. It will.
So it's kind of like people that grind teeth, or like you say, clench your teeth. I know at one point at night I would clench my teeth, and I do find that I still do it every now and then. So sometimes I'll use like a mouth guard to prevent that.
Now mouth guards increase your level of grinding.
Really?
Oh yeah.
They're patients will either grind through them if they're lucky. They'll grind through it so they can't use it no more, or they'll take it out. But it
Well,
can
I stopped
actually
using mine because it's uncomfortable.
well, yeah, exactly. If it was comfortable, you would use it. I had a patient. This is a funny story. I don't know what this patient was thinking about, but she thought I charged her too much. But I made all her symptoms go away, and so we actually went to court.
Wow.
And she told the judge the story, and my assistant was with me. I said, look at the judge. Don't say anything. She's going to do everything for us. And the judge asked her, she said, ma'am, well, did you give the appliance back? She said, no. She said, well, I can't help you if you won't give the appliance back.
Right.
She wouldn't give them back. If she would have given them back, the judge would have awarded her probably something.
Right.
But she was getting so much benefit from them, she would not give them back. So if it's working for you,
Right.
you're not going to want to give
You're not
it
going to want
back.
to give it up.
I would have to wrestle you to the ground to get it away from you. Okay? And here's why the night guard doesn't work. What triggers clenching or chewing is pressure on your maxillary first molar. Okay? When those teeth don't touch, you won't get the signal for these muscles, your temporal muscle, the muscle on the side of your jaw. It won't contract. I call it cutting off the switch. So when only your first 4 teeth in the front of your mouth touch, there's no signal to the brain to clench. So it cuts off the switch. It's like going to bed at night. You cut off the light. You cut off the stimulus. So you can't clench. Most doctors do not understand. The vast majority of doctors do not understand that, and the profession doesn't understand it. It's kind of a tragedy that the profession doesn't understand that, and they promote night guards, but they simply do not work.
Wow. Okay, that's good to know.
Is that something?
Yeah,
Maybe in some cases nothing is always nothing is 100%, but in the majority of cases it does not. And why even go that route when you can design something that cuts the switch off so it's impossible to clench?
Yeah.
So why even go that route?
you
No, we don't want to
Oh,
pull
I
on.
like my teeth.
We don't want to pull on
I'm
your
sorry.
teeth.
I'm vain on that point.
So the thing that's going on with that is what the TMJ is the lower jaw being too far back. When the jaw goes back, the head comes forward. Okay, when that head comes forward, if your head is forward, you can't, like if I'm sitting up straight, I could turn my head almost to the shoulder.
Right.
If my head comes forward, I could only get it right there because of compression and friction in the joint. Now, also, if my head is forward, I can't elevate my arms straight up. If my head comes forward and you try and do an elevation from here up, the joint gets tight. It functions under compression. And if you're in that position for, say, 30 years, you're going to end up having the rotator cuff surgery, and you're not going to know how you hurt the rotator cuff.
Wow.
There's 2 types of trauma. There's something called macro trauma, which is small amount of injury over a long period of time, or you can have macro trauma, which is what you see in an automobile accident. We don't deal with micro trauma very well in this society because it's hard to make money off of micro trauma because it really requires you to sit down and really get into what's going on with your patient to figure out where the injury is, when it started. So you got to take a really good history.
A lot of dentists don't put that time in.
No, they don't.
To get to know their patient, to try and figure out where different things are coming from. It's whatever you go in and you tell your dentist that you're having issues with, that's the only thing that they're going to treat.
And there's a lot of I wouldn't say, I don't have any data to support it, but I do know this. Some toothaches are caused by the muscles, especially pain in the upper molars. It can be caused by a spasm of the temporalis muscle, because the temporalis muscle comes all the way down from here to about here inside your mouth, and it inserts into this bone here, and it goes all the way down to here, all the way down from your ear down to on the inside, down the long part of the jaw. If that's in spasm, it can cause you pain, and there's just a simple way of checking that. And if that muscle is in spasm, the tendon of that muscle is in spasm, it'll cause you a lot of pain just by palpation. And so that would rule out like a root canal. Okay.
So what are your thoughts about the tooth fairy?
The tooth fairy, that gets into metaphysical things and spiritual things. I'm pretty much not for, let's say, tooth fairies and Easter bunnies and mythological things that are that border on the mythology. Okay, because once you start believing in one of those things, it's easy to start operating on a belief system rather than a fact system. Because in the no hype zone, we deal with facts.
My parents would tell me, "Oh, Frankie, there's the tooth fairy," and we would always put our tooth under our pillow, and the next day it'd be like money in there. So I vote for the tooth fairy.
You vote for the tooth fairy? Okay.
Yes,
All right.
Just let you know, I vote for the tooth fairy.
And I do give teeth to the children that I extract teeth on. But
they're collecting, believe me.
but
Doc, I'm gonna interject real quick because we're getting ready to wind down. I want you to give people information on where they can find you.
Okay. One of the things, can I just make this statement? I'm committed to our community here in Capitol Heights. One of the things that I've done is I have created a program that I call Club Dent. Okay. And it's really designed for people that don't have dental insurance. Okay. And
a lot of black folk.
Yeah, and there's a lot of people, period, and that's a lot of black folk. And I have come up with a plan. Let's just say cleaning, X-ray, and exam. Okay, $49. Now, when you go to a dentist, and you pay for the exam, you pay for the X-ray. Sometimes patients are tapped out.
Right.
Because that could come to easily $200. Okay, and then you walk away not getting any issue address.
Right.
Okay. All right. So with let's say just dealing with cleaning, I brought the price down to $49. Okay, and it will be $49 for a long time until I have a overall price increase. So if you keep your appointments every 6 months or every 3 months, whatever is appropriate for you, I'll maintain it at $49. Why?
Wow.
Because if you're doing what you're supposed to do at home and you're keeping your frequency of cleanings, then the cleaning becomes easy. So now I pass the lack of effort, the lack of labor on my part, you get the benefit for it.
Right.
Because you're doing what you're supposed to do at home. Right. Guess what else happens? You have fewer cavities.
Right. I agree with that.
Okay, so you don't get the disease. You don't get periodontal disease because you made the hygiene. And if you're brushing and flossing, it solves a lot of dental problems.
Amen, brother.
I went to a dentist, and one dentist told me I needed periodontal work. And then I just recently switched to a different dentist's office. And I asked them, I said, they said I needed the deep scaling and all that. And they looked at my mouth. He was like, no, you don't need any of that.
Yeah.
Everything is perfectly fine.
Yeah, a second opinion never hurts.
Yes, definitely.
Second opinion never hurts.
Yeah, well, my uncle just went through that, and they told him he had to have. I didn't tell you about this. He's supposed to have heart surgery. Like
And
they
they
were
said
gonna
he couldn't
cut.
do it until his teeth was clean.
No, he's supposed to have heart surgery. They're gonna cut his chest open and do bypass emergency surgery. He went in. And then one day they said, and then when they called me and said, well, we're prepping him, come get his stuff and all that. And I'm on my way to the place and they called and said, nope, guess what? We just looked at the x-rays again. He doesn't need it. We can treat him with medication. We're going to release him today.
Wow.
At that moment, I said, well, you need to admit me. Because, Doc, so what you're doing is extraordinary, it's special.
Yes.
And I know you're busy. Well, I'm not even going to get into that. I know you're busy. We're all busy. You have to come back. Coach Tanya and Frank, look, them jokers are not here. It's a broader story that we need from you.
Yes, sir.
Right,
Absolutely.
so
Just let me know.
So, I'm letting you know now.
Okay.
All right, so you're welcome back next week? Next Monday
It's
night?
fine. Next Monday night is
Next
good.
Monday's fine?
Yeah, to continue it.
Yeah.
Awesome. And then next week, we're also going to have Miss Tammy Watson, who is in charge of my wine club.
Wine.
Yes, and we're going to have a great time. Dr. Davis, man, you know I love you. And I
Thank
do
you very
appreciate-
much for the opportunity. I appreciate it.
Awesome. And you'll be able to see this, they're watching it live, and you'll be able to see it in color and in memory on YouTube, as we go. Ladies and gentlemen, Frankie J.
Yes, sir.
Coach Tanya.
Yes.
Roll Up Grimes. Roll Up Grimes, your chocolate date on a Monday night. We'll see you real soon. We're going to take it away with some more music from Mr. Mark Williams. And folks, Dr. Davis and I and the crew, we're saying good night and
Peace
goodbye.
out.
Good night.
Good night.
Just look at you. Hair done, nails done, and your taste in clothes are impeccable. But you know what makes me happy, baby? Do you know what really makes me happy? I love it when you dance. When you dance. When you dance. For me. Your poetry in motion. A treat for all eyes to see. Your movements are so sexy, but never too obscene. You're lost in the music. Girl, you found your space within this groove. Your body's waiting like the ocean.